Hi, I'm Danica Koopmans.
And I'm Sharon Hughes-Geeky. We're your hosts of Docs of Vernon. This is an interview and podcast series designed to help you navigate the healthcare system and get to know the physicians that provide your care.
Topics include what the heck is a hospitalist, treating addictions, and alternatives to going to the ER, plus so many more.
This is your link to healthcare in your community. Today I have the pleasure of talking with Dr. Sergey Reznikov, a pediatrician at Vernon Jubilee Hospital. He's going to tell us all about ADHD in children. Welcome, Sergey.
Thank you. Very nice to be here.
So let's start by finding out what are the symptoms that you look for in a child with ADHD?
Absolutely. So ADHD is what we call neurodevelopmental condition, basically a difference in brain development, and this is something that's there since birth, but really we start looking for these symptoms around age 4, 5, or 6. The kind of things we look for are inattention, so that means forgetfulness, difficulty focusing, needing a lot more reminders than other children, forgetting or not listening very well at all compared to other kids their age. We look for hyperactivity, so that's the kid who's always fidgeting, bouncing, moving, can't sit still, like a little motor running in them all the time, and the impulsivity, and that is blurting things out without thinking, with things they might regret after, just doing actions like, oh, I'm gonna make this jump, even though they might not really want to do that, all those kinds of things. So the impulse control, the hyperactivity, and the focus issues. Sometimes there's behavior difficulties as well that come with that as a result of this child getting consequences or experiencing negative effects because of their brain being a little bit more distractible or hyperactive. But those three are the main sort of categories that we look for.
So you hear more and more about ADHD in classrooms. Is it because it's becoming more prevalent, or is it being diagnosed more often?
It's the latter. So ADHD is a genetic condition. This is something that most kids with ADHD will have family members running back generations who've had it. Whether it's been diagnosed or not, because of course it is a diagnosis that's only in the last few decades has become more known. That's part of the reason also why we see more of it is nowadays we have a lot more knowledge, more information about it, and there's a lot more support available. So a lot more parents are coming to us and to teachers, to family doctors and so forth for help because it is available now, whereas 30, 40, 50 years ago we did not have the same knowledge, we did not have the great medications we have now, we didn't have the same support systems available through school or through the medical system. So we are seeing more of it, and it may feel like it's a lot, but actually 1 in 10 to 1 in 20 kids have always had it. We just know about it more now.
So once a child goes on medication, are they on medication for life?
Great question as well. I get that a lot. The medications we use most often for ADHD are long-acting stimulants. So these are medications that act on the dopamine and other receptors in the front part of the brain, the parts that are affected by ADHD. They last from the morning all the way through the evening, and we're off in the evening so the child can sleep. These medications work the day you take them, and they don't work if you don't. So if a child starts this medication, let's say around age 7 or 8, and it's working well, they might be on it for a number of years if it's still helping them. If it's not helping them, of course, we will not keep them on it, or we might try something different. But if they're getting the benefit, great. If as they grow older, they learn to control their ADHD symptoms better with different techniques and strategies, then at that point, they can make the decision. Are they going to stay on it every day? Are they going to use it only for days where they really need that sustained focus, like if they're going skiing or if they're having a test or an interview? Or they can just choose to come off of it and see how they do. It's very much going to be a personal choice of the patient and family.
Do you ever outgrow ADHD, or do the symptoms lessen with age?
So similar to the last piece, some symptoms do improve over time for most patients, others will persist. I tend to find that focus difficulties do persist with time, even into adulthood, unfortunately, for these patients. But at the same time, the hyperactive and impulsive symptoms tend to get better. So kids, over time, especially getting into teenage and adult years, some of them will learn to control their impulses a lot better. And that's why the official rates of ADHD in adults are lower than in kids, even though we know the genetics don't change. So if a parent's concerned about their kid's behavior, or if somebody else like a daycare provider, a teacher, a family physician brings concerns to them, they can ask their family doctor for a referral to pediatrician, or the family doctor may be able to do an assessment themselves depending on their comfort level. Usually around age 4 would be the earliest we could diagnose, but 5 or 6 is probably more reliable for diagnosing ADHD. The process involves questionnaires from home, questionnaires from school, an interview with a physician, and also a physical exam. Big part of it is ruling out any other conditions that might cause it, whether it's iron deficiency, sleep apnea, or other things that might look like ADHD. But once we can definitely narrow down the diagnosis around age 5 or 6. And it does unfortunately take a long time to get into a pediatrician nowadays, so we recommend starting the journey earlier rather than later to make sure that you get to us as soon as possible so we can help your child as soon as possible.
Are there any resources available for parents that are worried about their child?
Yeah, absolutely. I mean, first step I would say is definitely talk to your family physician or nurse practitioner or other primary care provider. And if you're looking for more online resources, I have to plug and recommend Kelty Mental Health, Kelty Mental Health. It's by BC Children's Hospital, has a lot of really good resources, including lots of videos about ADHD. There's also a great online course if you suspect your child is much more hyperactive or impulsive or distractible than other children. Kelty Mental Health also has a free online parent course for how to put in parenting strategies. And especially before age 6, that's the first thing we want to do as a parenting strategy before we look at medication at that age. The course is called Rolling with ADHD. That's ROLLING with ADHD. Check it out online. Highly recommend it as well.
So I have one last question for you, and it's probably not your area of expertise, but right now on the internet you see all the time adults that weren't diagnosed with ADHD, and if you drink coffee at night and can get to sleep right away, then you have ADHD. And so a lot of adults are now figuring that they have ADHD that was undiagnosed as a child.
Yeah.
Tell us about what you should do if you suspect you have it as an adult.
Yeah, absolutely. Great question. And without endorsing the TikTokers who say those kinds of things, I will say that oftentimes people do come to that realization later. A lot of people, 30 or whatever years ago, were missed with this diagnosis. And are coming to that realization now of, I struggled, whether it's in school and in the home environment with relationships, because of this difference. At the same time, I do want to plug that it's not all bad. There are strengths. These people will usually be more lively, more humorous, more energetic, more creative in some ways. So they might have those characteristics too. To get help, there's multiple avenues to pursue. As an adult, people can go to, again, their family physician, nurse practitioner, or other primary care provider. They might be going to a psychologist who is also able to diagnose it. Or they can go speak to a counselor who might not be able to diagnose it, but can help with some of the symptoms. Lots of different avenues and resources there. I always advocate speaking with your healthcare provider and seeing because, very well, especially in women, we tended to underdiagnose, but in a lot of people, 20, 30 years ago.
Thank you so much for speaking with me today. I'm speaking with Dr. Sergey Reznikov, pediatrician at Vernon Jubilee Hospital. I'm Sharon Hughes-Geekie, your host of Docs of Vernon. Tune in tomorrow for another great episode. See you soon.
Thank you very much, Sharon.